diabetes. My story, our journey.
We can beat it together.
The Diabetes Across the Life course, Northern Australia Partnership, is a collaboration of researchers, health service providers, policymakers and community members. Together, we are working to address the intergenerational epidemic of diabetes among Aboriginal and Torres Strait Islander people. Families and communities affected by diabetes and related chronic conditions are at the centre of all that we do. The partnership, based at Menzies School of Health Research in Darwin, was founded in 2011 and now has teams and collaborations across Northern Australia. For our research and translational efforts to be effective, appropriate and sustainable, we prioritise Aboriginal and Torres Strait Islander governance through the advisory group, community engagement and privileging the voices of people with lived experience. In all our projects, we integrate knowledge translation activities and opportunities for two-way learning, capacity building and training. Our research highlights the importance of a life course approach to preventing and managing diabetes, with a particular emphasis on the health of young people and women before, during and after pregnancy, as this impacts multiple generations. In response to the growing epidemic of diabetes among Aboriginal people in the Northern Territory, we organised the NT Diabetes Summit 2022 in partnership with Northern Territory Department of Health, Aboriginal Medical Services Alliance of the Northern Territory, Northern Territory Primary Health Network and Australian Government Department of Health and Aged Care. The summit was attended by more than 300 key service delivery, policy and community stakeholders. The two-day event focused on sharing knowledge and developing solutions in partnership to prevent diabetes and related complications. This video reinforces our submission recommendations with highlights from the NT Diabetes Summit, as well as recent insights from participants in our Youth Type 2 Diabetes program of co-design work.
So Type 2 diabetes epidemic among First Nation Australians here in the NT is alarming, as we all know, and it requires our urgent attention, and not only from government and non-government organizations like we are here and agencies, but also from our communities. The social and cultural determinants of health contribute to the epidemic significantly, and this epidemic is intergenerational in nature. So it's quite significant what we are all trying to deal with here. And I guess give you some data and some numbers. One in three people, Aboriginal people living in remote Northern Territory are living with diabetes. I'll just say that again, it's 1 in 3 adults out of communities have diabetes. That is at least 5 times higher than the comparison with the rest of the general Australian population. And this number, as alarming as it is, underestimates the impact that we actually see in diabetes among young people when the rates are 20 times higher compared to the rest of the Australian population. Another important sort of set to consider is that diabetes in remote NT has doubled in the last 15 years. So we have twice as many diabetics now in our communities that we had 15 years ago. And you could look at this from different angles. It could be that we're getting better at diagnosing them and we're getting better and finding out diabetes early. But at the same time, we're probably failing to prevent it. And that's one of the reasons we're going to be talking here today. How do we tackle this growing epidemic? Another sort of alarming number is that the new onset of diabetes is peaking at a much younger age in our population. Diabetes is peaking around 30 to 50 years, when in the general population peaks between 60 and 80. So diabetes is not only affecting our communities more aggressively, it's affecting our people at an early stage. And people are living with diabetes for longer, and we're living with the consequences of diabetes as a result of that. Recent work from Menzies reported rates of diabetes here in Central Australia, Aboriginal people, that are some of the highest in the world. We compare when we talk about diabetes in pregnancy and diabetes in young people, and that's people under 25 years of age.
We urge the Australian Government to consider our recommendations and prioritise initiatives that align with 3 key priority areas. The first is public and community awareness of diabetes.
We do have a lot of differences in our cultures with the people that we work with, but we have to balance our culture and our traditional ways of healing practices. And ngangras, doctors, balance of milk, we can't have just lender or couple and health for our people. Just can't have this. The Western system deal with there and researching our people all the time. We got researchers, we got ngangras, we got people that from the ground up to come and balance that, and you can do that. Well, our countrymen, and you can you together can make it happen.
The scary parts were when I'd go on excursions and I'd have to bring like my Ziploc bag with my metformin and all of that insulin and stuff, and it was just I was feeling like so left out because I didn't see any other teenagers with diabetes in school. I mean, there may have been, but they definitely didn't share it with me because it was like shameful enough, you know.
We need to get more information out to young people. There's higher rates of young people with type 2 diabetes now, so we need more research and we need more resources to get out to our young people about how to prevent it and how to deal with type 2 diabetes if they have it.
Priority 2. Social determinants of health and cross-sectoral collaboration.
Just with the medication alone is just scary because how much medication you have to take for diabetes. And then you've got to have a working refrigerator for other medicines like for diabetes, you know, and some of these mobs don't even have a fridge. So it's scary, you know, and I think it's very much serious than people are taking it.
I grew up in Broome, the Kimberley, and I've seen a lot of disadvantage that our mob go through, you know, with housing, our health, and I realised a lot of our young people and old people passing away too soon, and I just seen that.
I think lack of employment, lack of training, and lack of housing. I was living just like everybody else, you know, with other families, so living with other 20 people in the 3-bedroom house. That was an issue for me, and well as for my family, my wife and 3 kids. We have to share things, you know, with others, and that was not good.
But here, we see the price gap between the cost of food in remote community stores and urban supermarkets, and these are not urban supermarkets down south, but up here, 52% more. So this means that, you know, so many of you and other people in remote communities are paying 52% more for groceries.
And what sort of advice around changing your way of living did you get from the doctors and the health professionals?
Healthier food, more water. But, you know, living in a community, it's very hard. Because when we want to go to the shop and get a healthy food, it's very hard. The healthy foods are up there, while the takeaways are easy to buy, it's cheaper. So when we go there, we know straight away, I got enough money to buy that than this.
So healthy foods were more expensive?
Yep.
And that's in Ali Krung?
Not on Ali Krung, there's other communities as well that have that problem.
Priority 3. Access to high quality care.
Advice I would give to health professionals about these new diagnosed patients is giving them time to accept it, but using us as health workers to slowly, you know, implement it in their minds, and so they're aware that they have this, and I guess being in community, having cultural awareness about shameness and everything that is around in this community, and any community, I guess.
My experiences with a lot of the health professionals at the time really wasn't that pleasant. I dealt with some doctors and nutritionists and diabetes educators who kind of look past you and just see you as like this, the disease and how to treat the disease, and if you're not treating it well, then you're a bad diabetic. You know, they kind of forget the humanity in that, and that's kind of what I struggled with. You know, remembering that there's a person there behind the disease is definitely important. Trying to not make someone feel bad about when they don't get it right. You know, the person's still learning. It's already someone going out of their way to see a doctor and see a health professional, that there's a person there living a complex life.
So when we have someone who don't want to come to the clinic, We have health workers who can go out, health workers and nurses who can go out to home visits to the patient's place and yarn to them there and then and see them. And we can actually treat them at home too if they would like, if they feel more comfortable.
The role of Aboriginal staff, whether Aboriginal liaison officer, Aboriginal health practitioner or Aboriginal health workers, is critical to build a relationship with families over time and engaging with their care. We must also continue to look at new ways of ensuring that our primary healthcare services are high quality, accessible and acceptable to our Aboriginal clients who have already contracted diabetes.
Thank you for this opportunity to provide input into the Parliamentary inquiry into diabetes. Please consider the additional detailed information in our written submission. Many of our recommendations align closely with the Australian Government's Australian National Diabetes Strategy 2021 to 2030. We urge the Government to develop an implementation plan to sit under this strategy and to fund and track progress towards achieving the goals outlined.
Diabetes, my story, our journey.
We can beat it together.